Hi guys, welcome back to my channel, and today I have a very juicy topic for us. For those who don't know me, my name is Leah Teplitsky and I am your mellow keto mom talking about the ketogenic lifestyle and everything that is related to pregnancy, fertility, postpartum nursing, and baby's nutrition. So you can reach out for me for any questions that you have regarding those topics. So I've been trying to make this video for so long and life is just so busy, and I finally get to do that. So I hope this content is going to serve you well. So let's get right on it. So today's topic is constipation and hemorrhoids. And if you are pregnant and have difficult time to go to the bathroom, you should stick until until the end of this video, because I'm going to share some of my best advices that I give to pregnant women regardless those situations. And you really don't have to have this condition, so stay with me. So this video is a little bit of a smelly topic, but we have to talk about that, right? So if this is happening to you, you might ask yourself, does it have to happen to me just because I'm pregnant? And if so, how long am I going to be in this shitty situation? So if you will still stay till the end, I promise that you will know everything that you need to know, and you can say bye to this pain in the ass, literally. So to start, if you're struggling with this issue, you should know that you're not alone, and about 10 to 40% of women will experience constipation during pregnancy. There is no good time to be constipated, right? And definitely not while you're pregnant. So luckily for us, we can resolve this issue relatively easy. So first, let's explain why this situation happens to us potentially. So during pregnancy, we experience elevated hormone levels, which affect many of normal functions in our bodies. And second, our uterus physically obstructing our colon, which then decreases activity levels in that area. The third reason is that we have lower levels of motiline, a gastric hormone that controls intestinal motility. Another reason is enhanced water and electrolytes absorption in the colon. And finally, if some of you are using any kinds of supplements, like maybe iron or calcium because of nutritional requirement, you may as well experience constipation for these reasons. All right, so as you can see, these two things are out of your control, but it doesn't mean that you can't do anything about it. So how do we solve this? Okay, so now that we understand the why, isn't it relieving, right? Like for me, knowing the why is like such a huge relief, but maybe not for everybody. Anyways, let's dive into the how to manage it. I'm sure that you heard this advice before, but getting the right amount of fiber and fluids is really important. When increasing your intake of fiber, you want to do that gradually, and along with that, increase your fluids. Doing it too aggressively can lead to even worse situation. So you have to be doing that consistently and gradually. So you also want to consume a good balance of both soluble and insoluble fiber. I would not recommend to take a fiber supplement, because those supplements are usually have only soluble fiber in them, and this is the ones that are actually dissolving in water. Those are the soluble ones, and these alone are not going to do the work. So you really need to have a good combination of both soluble and insoluble fiber. So foods that have a good fiber balance will be lentils, beans, berries, non-starchy vegetables, shredded coconut or coconut flour, almonds, and avocados. I would not recommend some of these foods though, like the lentils and the beans, for other reasons. So, if you decide to up those foods in your diet for the sake of solving constipation, then I will recommend to pay attention to the carb to fiber ratio. What I mean with that is that some foods have more carbs in them than fiber. So, in comparison to other foods. So, for example, 1 cup of brown rice has 45 grams of carbs, but only 3.5 grams of fiber, while half of an avocado have 8 grams of carbs and 7 grams of fiber. Got it? Fiber to carb ratio. So you should aim for about 30 grams of fiber minimum per day. With all of these recommendations, there are still many women that fiber doesn't work for them. Don't be frustrated. In fact, actually, it's really not a bad thing at all. And I am one of those people sometimes. And it's really also changing with time. So you should try both of those methods and see what works for you during pregnancy. One of them is going to work. So just stay focused and positive. So eating enough fat is key to having regular, easy to pass bowel movement for several reasons. Dietary fats and oils help to lubricate, literally there's no better word for that, your intestines, it's a hard word for me, intestines, and keep bowel movement from becoming too dry and too hard. So fat stimulates the release of the bile from the gallbladder, which naturally stimulates the movement of your intestines and facilitates propulsive contractions of your colon. So, in other words, fat helps you to poop. And if you are skimming fat from your diet, like putting the least possible amount of oil in your salad, or taking the fat out of your soup, or throwing away the extra fat that was left in the pan after cooking the meat, and you're experiencing constipation, then it's time to make some changes in your eating habits. You can pour the extra fat from cooking, the bacon or the meat that you're making, on your veggies. You can add cream to your coffee. Eat the crispy skin from the chicken wings. Adding 1 table of coconut oil to your breakfast can be very effective to trigger the morning bowel movement. So, isn't that sounds delicious? Really? Like, just more fat in your diet and you're gonna be so much happier. I can promise you that. When consulting to pregnant women regarding constipation, I would definitely try the fat approach before the fiber approach. You deserve to have an easy, enjoyable pregnancy. So, besides the nutritional part, there's also a few more things that you can do to improve bowel movement. First, move, exercise. Even daily walk may be enough. I would strongly recommend exercise that involves gentle twists from side to side, or all kinds of twists. These can give your intestines gentle massage and may help things to move a little bit better. Second, incorrect posture can absolutely affect bowel movement. So, like for example, right now, I'm recording this video while I'm sitting on the floor, which I found that there is a great light coming from my window. But besides that, I'm sitting on a yoga brick like this. And so my pelvis is really rotates forward, which is a better sitting position than you will have than when you sit on a chair. So if you are a sedentary person or you work a lot while you're pregnant, pay attention to your pelvis's position. This can be a very strong motivator for bowel movement, because if you're stuck in a posterior position, this can create a lot of trouble for you. So pay attention to the way you drive your body during the day. Remember, it's all connected. Third, supplements. There's some supplements that you can take to improve or worsen the situation. What I do want to recommend is magnesium citrate. So not any other magnesium supplement, just this one specifically. One last tip, consider your position of sitting on the toilet when you are in the bathroom. So remember that traditionally we weren't supposed to sit, rather to squat to poop. So squatting position puts your colon and pelvis floor muscles into this perfect alignment to have an easy bowel movement without straining. You can use a fantastic tool that I personally use, the Squatty Potty, or just find a creative way to elevate your feet from the ground to imitate a deep squatting position. So this is what I have for you for today, and I hope those tips were beneficial for you, and you can go to my YouTube channel and see other videos that I did regarding the ketogenic lifestyle and pregnancy, fertility, postpartum, baby's nutrition, and nursing. I would love for you to let me know if you like this type of content, and share your story or share your comments about it below. Like it, share it, and hopefully we will meet each other soon. Have a great weekend and take care of yourself in this storm that is coming up to us. All right, guys. Bye.